And as we regularly do each morning, we check in with the latest article from our FlowNews24 Canberra correspondent, John McDonnell. And it's quite a different piece from John, quite open about his own personal health and why he's getting the vaccine. He's someone over 70, so slightly older than myself, and has type 2 diabetes, which he claims is an occupational hazard for journalists. But in any case, John is someone who is probably more likely to need to get the vaccine sooner rather than later. He's received the AstraZeneca vaccine yesterday. He said he had some concerns about getting the vaccine because of some warnings from people about the blood clotting risk, but he's weighed up the risk of getting a blood clot versus the risk of actually dying from the virus and has decided that it is probably better that he goes ahead and gets the jab. And being the AstraZeneca jab, he'll need a follow-up shot in June to make sure that it's fully effective. And sharing this with you today, I'm going to say I'm agnostic about the whole vaccination program because I think it's important. We rely on the evidence we can see from around the world about how that's working out. But I thought, looking at John's experience, it would be relevant to look at another group of people who are going to be getting a second follow-up jab fairly soon, and that's our compatriots over in the United Kingdom. And looking at the mass vaccination program that's underway in the UK. Got some data to share with you from the United Kingdom and just comparing some figures from other parts of the world. So looking across the globe, there have been 132 million cases of COVID-19, where the United States of America now tops that count with 30.4 million cases, followed by Brazil with 13 million, and now India with 12.8 million. And certainly India is rapidly moving up the charts there. France 4.7 million, Russian Federation 4.6, and the UK 4.3. Now, these are World Health Organization figures. They do show that China claims it's only had 100,000 cases, but those figures in the millions of cases for some countries compare for Australia with 29,000 cases, which sits us somewhere between Thailand with 29,000 cases and Malta with 29,000 cases. Even Jamaica, Uganda, Senegal, Zimbabwe, Malawi, Sudan are all sitting ahead of us in terms of the cumulative number of cases. When you look at the number of deaths that have been attributed to COVID-19 in Australia, there's 909 deaths that have been attributed to it, and only 8 attributed to it in Australia in the last 24 hours on the WHO website. But of course, I know there's some people who dispute the counting of that death attribution, but if apples are being compared with apples around the world, when you look at those relatively low figures for Australia, the United States has 552,000 deaths attributed to this virus, 356 such deaths in the last 24 hours. That compares with Brazil, 332,000 with 1,300 deaths in the last 24 hours. And India, as we're reporting in the news, 166,000 deaths with 630 recent cases. But the UK, 126,000 deaths, so just below India in terms of the total number of deaths, but only 20 deaths attributed to the virus in the last 24 hours. The UK started a mass vaccination program in December when cases were looking really bad, and now they are one of the world leaders in terms of the number of vaccination doses administered. They've had 51.6 doses administered per 100 population, so that's more than half of the population vaccinated since they started in 21 December. The United States is one of the other leaders. They've vaccinated 46.6 per 100 population of their citizens. Only Chile have a higher rate of doses administered per 100 population at 54.73. So bringing it back to Australia, we've had 164,000 doses administered. Vaccination program started a couple of months after the UK. That's 0.65 total doses administered per 100 population. So less than one person per 100, less than 1% of the population vaccinated. UK at 50%, but when you compare the amount of community cases, we've had about 0.5% of the number of community cases than the UK has. So that's when you're not necessarily comparing apples with apples, because you haven't had a raging number of cases in Australia like you have in the UK. But certainly going forward, we're going to need to look at just how many people we're going to want to have vaccinated before we open the country up again.